Good evening and Jai Hind everyone. I am Yatee Krishna of class 4 and I want to introduce you to Dr. Pallavi.
Hello.
Thank you so much ma'am for giving me your valuable time to tell me the importance of teeth.
You're welcome.
So first, can you tell me some useful things about our teeth and its structure?
Okay, I'll tell you about teeth and its structure. So what is the basic function of the teeth is for you to chew your food. What food you're eating, you just cannot gulp it. You need to bite. For that, our teeth comes into picture and helps us break down the food particles into smaller particles, and then digestion is better for the stomach. So that is the main function of the teeth. Second function is it makes your smile wonderful. Imagine having no teeth in your mouth and smiling. This is still a smile. It's looking so beautiful, right? So that is the second function of your teeth, to give a structure to your face as well as to your lips. Otherwise your lips will fall back if you don't have teeth. Again, the way you speak, if you don't have teeth, what happens is it stops the tongue at a position. So when you speak few letters, you are able to speak clearly. If there are no teeth, your speech becomes, it's not clear at all. It's just the tongue can go anywhere and it feels that you are just babbling away something. So even that is the function of the teeth, that you should be able to speak properly. So these are the basic functions of your teeth. So now basically what the teeth has, what are the parts of the teeth, right? So you want to show in this? Okay, so this basically is how your tooth looks in the mouth. Okay, the top portion,
White one,
which is there is an enamel. It is the strongest portion of the tooth. Second layer is the dentine. Okay, the dentine is a layer, and it's below the enamel. And what does it do? It gives color to your teeth. It's little yellowish in color. So as we grow old, as our teeth starts wearing off, the yellowish color of the tooth starts looking around. The next layer inside this dentine is the pulp. Pulp is where all the nerves are there, which goes in and out of the teeth. So you want sensitivity or pain, if at all you have, that is because this pulp, it's alive like a nerve. It is reddish in color. It starts bleeding the nerve. Okay, so decay starts from the top portion, from the enamel. Slowly, if it's not been done, if you don't get it filled or you don't get a checkup done with your dentist, the decay will spread down towards the next layer and it will go to the pulp. So once it goes to the pulp, you start having very bad, severe toothache, right? So then you have to do all root canals and the treatment increases. So basically, you have to protect your teeth. You have to get a checkup done with the dentist every 6 months, because if there is a decay on the top, if the dentist comes to know that you have a decay, you get this filled. You remove the decay and fill it up, so it doesn't spread to your pulp or your tooth.
and what is the...
And these are the roots of the tooth, which is inside the bone. This is the bone. This is the part which is not seen in the mouth. On the mouth, only the top portion is seen.
enamel.
The crown. This is the crown of the tooth, and these are the roots. The roots are inside the bone, inside your jaw. You cannot see it. Only you can see the white portion of the teeth, small sizes. You can see your teeth, right? That's the top portion of the tooth. Okay? The roots are something which holds your tooth in the mouth. Okay? And this is the bone. It is surrounded by the gums here. And you have to get your cleaning done every once in a year from your dentist.
What
Cleaning is basically tartar which gets accumulated around your gums. It's a yellowish layer which forms. Plaque forms. Plaque is basically a soft layer of the food particle which gets stick to your tooth. Eventually it becomes hard if you're not brushing properly. And so the tartar starts building up. Okay? So you have to get it removed. That's why 6 months checkup. Whether you have any problem or you don't have a problem. You should get your teeth checked every 6 months.
and what is the correct way of brushing our
Yes, I'll show you. So if suppose this is how your teeth looks in your mouth. So if you're brushing the upper teeth, always hold your brush at a 45-degree angle. Okay?
What?
45-degree angle. And then brushing the up-down motion. As you go up, down, not like this. It has to be up, down, like this. If you can't do that, go for a circular motion. And always brush gently. Okay, not in a hurry, not vigorously, very gently. So if you're brushing the lower, you can go up, down like this. Same here, up, down like this.
But
And
we cannot do like this.
It doesn't make sense, no. It doesn't really clear anything much. So either you do circular motion or you do up-down motion. Up-down motion rubs, remove the plaque from your surfaces, food surfaces. Up-down motions, you are going up and getting it down. Okay, so this is how we brush your teeth. Lower, again, like this. Away
And
from the
how
nose.
do we brush this part?
Yes, this part is normal, regular, how we brush it, like this.
Okay, do
This
we have
is-
to brush back also?
Yes, of course, you have to brush it back like this. This is not normal, regular, this one you can do because this one, it's difficult to do it up down initially. So just brush it like this also. Yes. Okay, and twice a day brushing is important. Okay, after night, after dinner, once you're done eating everything, make sure you brush your teeth and sleep because that's a time, important time because that's when you're sleeping and 7 to 8 hours is a good hours for the bacteria to start decaying your teeth. So if you're not in the habit of brushing at night, please start doing that. That is very important.
But why do we brush in the morning? In the morning we don't eat anything.
You don't eat anything, but once you have bad breath, because the saliva is just like that, little bit germs, whatever you have, good bacteria is also in your mouth. So if you don't brush, you'll start having bad breath, bad smell from your mouth. You have, right? Yes. So that is why we have to brush our teeth in the morning as well. Okay, it keeps your teeth clean as well. And second thing is, as soon as you eat anything the whole day, make sure you gargle your mouth with water.
And what is flossing?
Yes, flossing is basically what happens is, see, if you're brushing it here, the brush really can't go in between two teeth. It's very difficult for it to go.
Yeah, but I have a gap between.
So that is okay. No need to floss for you as of now. But as all your teeth start coming out permanently, the gap will get closed. Okay? So the flossing, what it does is, it cleans the food particles which are stuck in between two teeth.
The permanent teeth is more bigger than
Yes.
the milk teeth, but still in milk teeth, premolars are not there. So if that is bigger, so does our mouth also get?
Yes, as you grow, your jaw increases, jaw size increases.
Okay. Can I ask you a few questions?
Yeah, sure, why not?
First, I want to ask is what actually is cavities? Can we stop cavities at an early age? And how does cavities cause decay and how to protect against cavities?
Okay, cavity and decay are the same. Okay, there's just two different words for them. Okay, so your first question was how do you get cavities?
No, it was what are cavities?
What are cavities? Cavities are basically tooth area which is not being cleaned properly. The food particles are there on the teeth itself. So our mouth has millions of bacteria. We have good bacteria as well as bad bacteria. So if there is food lodgement there the whole time and the saliva has bacteria, it's basically food for them, right? So what will happen is it starts eating the tooth along the food. It starts to break the food, tooth down, teeth enamel. Okay, tooth enamel starts to break down. And that's how it becomes a hole. Like suppose you have a tooth and the food particle is like stuck here and it is not getting cleaned properly. What will happen is you will start having, the bacteria will start breaking the tooth and it will have a small hole like this. And this hole is like an open area for the bacteria to go more inside. So it starts every day, whatever food you're eating, it will start going inside and all the bacteria start sitting.
And what if we brush it more? Will it the hole?
So if there is a hole, no, it will not close. If it is really minor, very small, and you are able to clean it properly, if you are able to maintain it by brushing, keeping it clean, then yes, the bacteria, the hole might not close. Little bit initial, whatever cavity, little bit formation is there, it will stop. It gets arrested there, then and there. But if the hole is a little bigger, the brush, even brush can't reach over there. Brush can reach only up to a certain point, cannot go beyond one point. So then you have to get it filled by going to a dentist.
Again, how does filling happen and by which thing?
So filling, basically what we do is, we remove this hole, whatever decays there, you can see as a black thing in your mouth. Okay, decays will come to know. It's a blackish part, there's a hole inside. So we remove all the blackish decay portion, we have to remove that. If we don't remove that, what is going to happen is...
we have to remove the whole thing.
Exactly, it will keep on expanding. So we have to remove the whole decay. And then we have white fillings, with color fillings which we have, that will cover it up with all the tooth. And then it becomes as a normal one layer, one tooth itself.
So after that we will have problem with eating
Nothing. And filling doesn't mean that everything is solved forever. or you think they're not going to bother you. Not like that. If one surface can get decayed, if you're not maintaining it, other surfaces also can get decayed.
And if we remove one teeth, the permanent teeth do not grow. So what in that case we do?
We have to then replace with implants or bridge, artificial teeth. We replace with artificial teeth. What we can make.
And can we stop cavities at an early age, 12 years old, 15 years old?
You can stop at even 3 years old also. How do you do that? What do you think?
Brushing properly,
Okay, yes.
Getting regular checkups.
You have to get regular checkups done. If you're getting regular checkups done, we'll come to know dentist will tell you that you have a cavity, get those filled. If you're not, it keeps on increasing, and when it pains and then you go to the dentist, then it's too late. Then it's become too expensive for the tooth. You need to a lot of things to save the tooth. So if you want to close it at an early stage, you don't want the cavity, you have to do twice a breast brushing. After eating anything, make sure you gargle, rinse with water, keep that area clean, and not keep on munching all the time. Even that is not good. You're not supposed to keep on eating every half an hour. Then yes, then again the bacteria starts working. So give some break in between for your mouth as well. And 6 months, and as I said, checkup. Just regular checkups.
And can we brush? Why do people suggest brushing only 2 times? Why not every time after a meal?
Yeah, that's a very good question. Because if you brush too much, the enamel starts wearing off. You're rubbing something on the tooth all the time, isn't it? If I see you're constantly eating, whatever it is, you're eating every few hours. If you keep on brushing every few hours, you're rubbing something on the tooth all the for that much time. So the enamel starts wearing off, and then you might have sensitivity. So overdoing of anything is also bad. So twice a day brushing is more than enough. And gargling in between is more than enough. Yes, if you have eaten chocolates, something which is sticky, which sticks to your tooth, then make sure you brush it. The chocolates, the more it remains in the mouth, the faster the germ starts damaging it.
Okay, my next question is, as we say that pulp provides nutrition to the teeth, but after eating the teeth do not get anything. So how come it provides nutrition?
See, nutrition is basically goes from your blood. You have to eat calcium-rich foods. Okay, so it goes in your blood, and then it supplies to your different body. It is bone as well as teeth. That's this. But then there is a limitation. You just cannot keep on eating calcium-rich food, saying that will prevent my tooth decay. At the end, it's you who has to do all these things as we discussed before. And yes, nutrition goes to your food. So the healthier your food is, the better your teeth will be. The healthier you eat food, the more you should avoid junk foods. Chocolates, very rare. Ice cream, biscuits, wafers, very rare, or a complete no if possible. So if you make the food junk food out, eat more of apple, carrot, fruits. It helps in cleaning the tooth as well. As you eat it, as you're chewing carrot, or you're chewing your fruits, it is cleaning. As you're eating, the tooth are getting clean. And these are the food particles which doesn't get stuck to your teeth. So they're not going to cause decay for you. But if you see chocolate, wafers, everything, these are the particles that stick to your teeth. So that is completely, if possible, you have to eat very less.
And after that, I want to ask you that it is said that we should not eat too much hot food, too much cold food. We should give some gap. I mean, if we are eating something like biryani, okay, and with that we have a combination of cold drinks. So at the same time eating hot thing and at the same time drinking something cold or maybe ice cream. So how much gap should we give? And not giving gap, does it affect our teeth?
Oh no, because you have to give gap in between as you eat your food. Again, as you said, fizzy drink, Coke, Pepsi, complete no. First of all, they're unhealthy, and the acid they're fizzy, right? You will see it's like bubbles come from it. It's a fizzy drink. It's more damaging for your tooth enamel as well. So fizzy drink is a complete no. If you're consuming it, please stop it. It is of no use. It's going to damage your teeth as well as your health. Okay? And as I said, give some break in between. It doesn't matter if you're hot. Obviously, you cannot eat more hot food. There is a limit to it. But if you're eating, as you said, you're eating biryani or something, you eat. After some time, just give it a break. Say half an hour break or something, and then eat something if you want. But again, after that, make sure once the lunch is done, don't start munching again within an hour. At least give me minimum 2 hours break in between before you start eating any other food again.
Okay. After eating food, why it is important to rest?
after eating food is important to rest, because the stomach goes, while you're eating, as you're eating it, the stomach starts working. The stomach's job is to start with digestion, right? So, and automatically your body tries to slow down, because all your energy, all your blood starts flowing to your stomach. Stomach needs that energy. So that is why it's always better to rest for some time after eating some food. That is, digestion is better.
Okay, I have one last question. Like fingerprints are unique of each person. Are dental codes also unique in crime cases? Are dental codes used to identify a person?
Yes, of course.
Can you tell me something about it?
Yes, because teeth eruptions are there. All the teeth doesn't come together. Each and every tooth in your mouth comes at a particular time, particular year. Now you have milk tooth, right? You have little milk tooth. You have some permanent teeth, some milk teeth in your mouth. So we come to know when some crime happens or when a person is dead, we should know the age of the person. We should know the age of the person. So the age of the person we come to know by seeing his dentition, by seeing his teeth. Wisdom tooth, which we get, mostly come after 18 years of age.
Wisdom tooth is the third set of the
Third molar.
yes.
It's a third molar. So wisdom tooth comes after 18 years of age. So if someone is having wisdom tooth and some crime happens, so when we look at the jaw, and we see, oh, there's a wisdom tooth which is already there in his jaw, that means he must be 18 plus. He must be more than 18 years of old. Or if he has milk teeth, so we come to know that person is not an adult, which is still a child, or what age it is sometimes. So definitely.
So if the person who has done the crime is 18 plus, so how we will know just by he has a third set? It doesn't make sense the way.
That doesn't. Obviously, the other. See, when does the crime, this one you're saying, forensic comes into? When a person has died, okay, and the body has been decomposed, like everything has been gone from the, only bones are left, and you can't really make out what is the age of that person. So that time we see the teeth. So that time we see the jaw. How many teeth are there, or
But only bones are left, so how teeth is left?
yeah, teeth are also sometimes there. Not all the bones doesn't decompose so fast. Sometimes police find the body after so many days. Everything doesn't decompose very fast. Even teeth, bones take time to decompose, to break down. So sometimes we don't come to know with a bone or something. It's supposedly burned. Someone has burned the body or something. Some crime has happened, or someone has been burned. So there is nothing to identify. We don't know who is that person. What is the age of that person? Sometimes teeth are left out. So with the teeth we come to know the age of the person. So dentition or teeth helps in even identifying for them doing the crimes also. Even teeth bite.
So dentists keep a record of their, tooth prints are different of every person.
Yes, of course.
Like fingerprint.
Yes, exactly. All tooth, even your tooth will be different, your brother's tooth will be different, everyone's is different. Tooth prints are different, and we come to know if someone says someone has bitten me or someone has come and has bitten me. So we have to get the marking, we come to know exactly which teeth, how he must have bitten the person.
Okay, but the tooth, when somebody bites us, only a line is left. How do we know how?
We come to know because we know the size and everything of a particular tooth. So we can help with that.
Okay. So do we measure the teeth? When different people's teeth are different sizes, so how do we measure the size? Because in
So there is a range of size of a particular tooth. If you take the central tooth, it has a range. It won't be so much, so big. It will have a range. So we come to know, okay, so this is the range, maybe this is the tooth which is involved. If someone has done it. It's a quite extensive.
If somebody's tooth is not of what that range, so do we make another frame of their size?
We can. Then that becomes a particular different, that becomes a whole new treatment. Yeah, different treatment for that. That becomes pretty complicated. Okay? Anything else you want to know?
No, thank you so much for
You're
your time.
welcome. Good questions you asked. And good in a way you have a lot of, thinking, and you're thinking so much and asking. So it's really, really good. I really appreciate it.
Thank you so much for your time.
Thank you, dear.
Thank you so much for answering my questions.
Thank you. Anytime. Welcome anytime. Thank you.
Thank you.